All right, today we're going to unpack a really important new study that could change how we protect our babies from a very common and sometimes very dangerous virus. It's a head-to-head showdown between two brand new tools. So let's dive right in.
If you're a new parent or you've got one on the way, this question, it's everything, right? Especially as we head into cold and flu season. The stakes just couldn't be higher when we're talking about the health of a tiny newborn.
Okay, so first things first. We need to talk about the virus that's at the center of all this, and that's RSV.
So, for most of us, right, getting RSV just feels like a really nasty cold. But for tiny babies, it's a whole different story. It can get serious, fast. We're talking deep lung infections. And believe it or not, it's actually the #1 reason infants end up in the hospital.
But here's the good news. We now have two really powerful new ways to fight back against RSV. And what's so fascinating is that they work in completely different ways to protect our little ones. Okay, so this lays it all out perfectly. On one hand, you've got the maternal vaccine. Think of it like this. Mom gets the shot and it basically trains her immune system to create this army of antibody soldiers. Then, she passes that army right along to the baby before birth. Pretty neat? Then, on the other side, there's the infant shot, Nirsevimab. This one's different. It's like, let's skip the training and just give the baby a squad of pre-made antibody bodyguards from day one.
And that, right there, was the huge question mark. Both sound great on paper, but we had no idea how they'd actually perform against each other out in the real world. Which one really does a better job of keeping babies safe?
Well, to get that answer, researchers in France did something pretty incredible. They launched this massive nationwide study. And that's where all this game-changing data comes from.
And listen, we're not talking about a small trial here. They literally tapped into the entire French national health system. They tracked over 42,000 newborns. What's really amazing, though, is how they did it. They matched up infants one-to-one based on all these key factors to make sure it was a super fair apples-to-apples comparison.
So, they focused on one single, really important RSV season. They signed up babies born in the fall and then just followed them for about 3 months. That's a median of 84 days, which is, right in the thick of it when RSV is at its worst.
Okay, now for the part we've all been waiting for. Let's get to the results. What did this huge study actually find out?
All right, so you've got two groups of babies, two different protection plans. What happened?
Okay, so if you look at both groups together, a total of 481 babies were hospitalized because of a serious RSV infection. That kind of gives you a sense of the scale of the problem. But the real question is, how did that number split between the two groups?
And here it is. For the babies protected because their moms got the vaccine, there were 269 hospitalizations. But for the babies who got the Nirsevimab shot themselves, that number was 212. I mean, you can see it right there. That's a pretty clear difference.
So what does that actually mean in terms of risk? Well, the study crunched the numbers. They call it a hazard ratio. But what it boils down to is this. The babies who got Nirsevimab had a 26% lower risk of being hospitalized for RSV. That's a big deal.
Okay, so that's hospitalizations. But what about the really, really sick kids, the most serious cases? Did one of these methods do a better job of protecting against the worst outcomes?
And this is where things get even more interesting. The advantage for Nirsevimab was even bigger here. We're talking a 42% lower risk of ending up in the pediatric ICU, a 43% lower risk of needing a ventilator, and a 44% lower risk of needing oxygen. I mean, those are some seriously significant numbers when you're talking about the sickest babies.
All right, so let's wrap this up. What's the bottom line? What's the main takeaway from all this incredible research?
Well, the study's conclusion, which was published in a major medical journal, says it all pretty clearly. They found that giving those ready-made antibodies directly to the baby with Nirsevimab, what they call passive immunization, was linked to a lower risk of not just hospitalization, but also those really severe outcomes we just talked about.
Now, the researchers themselves point out something really important to keep in mind. This was literally the very first RSV season that both of these tools were being used in France. So while these results are a huge deal, they're still just a first look. It's something we'll need to keep an eye on in the years to come.
And that leaves us with this really big, fascinating question. I mean, we are right at the beginning of a whole new way of protecting babies from RSV. As this kind of data from France starts to spread around the world, you have to wonder, how is it going to shape the choices that doctors and parents make? It's definitely going to change the future of infant health.